Asthma. Asthma is your body's way of overreacting to triggers such as allergens, exercise, cold air, pollution, respiratory infections, and stress. An allergen can be anything from flower pollen to dust. Imagine walking down a street lined with blossoming trees on a sunny spring day. The gentle breeze carries clouds of pollen your way. At first, you might feel a slight tickle in your throat or a mild cough as your body reacts to what it recognizes as a harmless irritant. However, for someone with asthma, this exposure triggers an excessive inflammatory response. The airways, which are typically relaxed and open for easy breathing, begin to constrict as the muscles around the bronchial tubes tighten. Simultaneously, excessive mucus builds up, further obstructing the narrowed passages. You may start gasping for air, finding it increasingly difficult to catch your breath. As the asthma attack progresses, your chest feels tight, as if a heavy weight is pressing on it. Each inhalation requires intense effort, but it fails to deliver enough oxygen. Uncontrollable coughing may occur as you try to expel the mucus and clear your airways, but relief eludes you. Soon, panic sets in as your breathing becomes shallower and more laborious. In severe cases, a lack of oxygen in your bloodstream can jeopardize vital organs. If left untreated, you may experience pale or blue skin, dizziness, or even loss of consciousness. Diabetes. Diabetes is a chronic disease resulting from the body's inability to produce or effectively use insulin, the hormone responsible for regulating blood sugar levels. Insulin allows glucose from food to enter cells and be utilized for energy. When you eat, the food you consume provides energy in the form of glucose, but without insulin, your body can't properly access this energy. There are two main types of diabetes. Type 1 diabetes, an autoimmune disease where the immune system attacks and destroys insulin-producing cells in the pancreas, resulting in little to no insulin production. Type 2 diabetes, the more common form where the body either fails to produce enough insulin or does not use it effectively, a condition known as insulin resistance. This type is often linked to lifestyle factors such as obesity, inactivity, and poor diet. As of 2021, 537 million adults aged 20 to 79 worldwide were living with diabetes, with projections estimating this number will rise to 783 million by 2045. Uncontrolled diabetes can lead to complications such as diabetic neuropathy, where elevated glucose levels damage nerves, particularly in the limbs, causing loss of sensation. This can result in unnoticed injuries that become infected, potentially leading to severe health issues. Diabetes can also increase the risk of blindness, kidney failure, and heart disease. It's crucial to understand that you do not have to be overweight to develop type 2 diabetes. An unhealthy lifestyle still poses a risk. Once diagnosed, individuals must continuously monitor their blood sugar levels and make necessary lifestyle adjustments. Hypertension. Hypertension, or high blood pressure, occurs when the force of blood against the artery walls is consistently too high. The body's blood vessels form a connected system powered by the heart. When arteries become narrowed or rigid over time, the heart has to work harder to pump blood through them. If left uncontrolled, hypertension can lead to severe and potentially life-threatening health issues. Several factors contribute to hypertension, including an unhealthy diet, smoking, stress, and genetics. According to the World Health Organization, an estimated 1.28 billion adults aged 30 to 79 had hypertension in 2019, with obesity being a significant contributing factor. Often called the silent killer, hypertension typically shows no outward symptoms. One potential complication is the development of aneurysms, weak spots in blood vessels that bulge outward, most commonly in the brain. If an aneurysm bursts, it can result in severe bleeding, stroke, or even death. Peptic ulcers. Peptic ulcers are painful sores that develop in the lining of the stomach or the first part of the small intestine, known as the duodenum. Having open wounds in your digestive tract can be extremely painful and discomforting. These ulcers typically occur when the mucosal lining is damaged, allowing the stomach's digestive acids to irritate and erode the sensitive tissue. The two primary causes of peptic ulcers are infections with Helicobacter pylori bacteria and long-term use of nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin. These medications reduce the amount of protective mucus in the stomach, increasing susceptibility to acid irritation. H. pylori is adept at weakening the stomach's protective lining, leaving it vulnerable to damage. If not treated properly, peptic ulcers can lead to severe complications, including the potential development of cancerous growths. According to the Centers for Disease Control and Prevention, about 1 in 10 people will develop a peptic ulcer at some point. Fortunately, with appropriate antibiotic treatment and medications to reduce stomach acid, most ulcers can be effectively managed. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, filling them with fluid or pus, which causes cough, fever, chills, and difficulty breathing. While viruses, bacteria, or fungi can cause pneumonia, bacterial pneumonia is the most common and severe form in adults. What might start as a mild flu can, if left untreated, develop into a serious condition where the tiny air sacs of the lungs fill with fluid and mucus. As a result, less air can move in and out, making it increasingly difficult for the lungs to oxygenate the blood properly. You may begin to experience shortness of breath as your body attempts to compensate for the reduced oxygen levels. As fluid accumulates, it can obstruct small airways, bronchioles, shutting off sections of the lungs and preventing gas exchange. Severe impairment of gas exchange can potentially lead to respiratory failure. Moreover, pneumonia can permanently scar lung tissue, reducing overall lung capacity even after treatment. This is why prompt antibiotic treatment for bacterial pneumonia is crucial to limit lung damage. Pneumonia is often referred to as a child killer due to its significant impact on infants, accounting for over 2.5 million hospital admissions and around 672,000 deaths among children under 5 globally each year. Sickle cell anemia. Sickle cell anemia is an inherited red blood cell disorder that affects hemoglobin, the protein responsible for carrying oxygen in the blood. It is caused by a mutation in the hemoglobin gene, resulting in the distortion of red blood cells into stiff sickle-shaped forms. These abnormal cells can get stuck in small blood vessels, blocking blood flow and oxygen delivery to tissues throughout the body. This leads to swelling in the blood vessels and extreme pain. Sickle cells are also fragile and break apart prematurely, causing chronic anemia due to reduced red blood cell counts. Approximately 300,000 infants are born with sickle cell anemia each year, with higher prevalence among populations originating from sub-Saharan Africa, South America, Caribbean islands, and Mediterranean countries. The genetic mutation associated with sickle cell anemia provided a survival advantage against malaria, leading to increased prevalence in regions where malaria is or was common. People carrying one copy of the gene are less likely to develop severe forms of malaria, providing a survival advantage in regions where the disease is common. As a result, the gene became more prevalent in these populations over generations. Arthritis. Arthritis is a general term for a group of conditions that cause joint pain, swelling, stiffness, and a reduced range of motion. While it can affect individuals of all ages, the risk increases with age. The two most common forms are osteoarthritis and rheumatoid arthritis. Osteoarthritis occurs when the cartilage cushioning the ends of bones gradually wears down. In a way, it resembles the wheels of a car, where the bearings and tires start to deteriorate over time. Without sufficient cartilage, the joints grind against each other, leading to damage and pain. Rheumatoid arthritis, on the other hand, is an autoimmune disorder in which the body's immune system mistakenly attacks the joints. This results in chronic inflammation that can damage cartilage, bone, and surrounding tissues. It typically affects smaller joints, such as those in the hands, wrists, and feet, often symmetrically, leading to deformities. While there is no cure for most arthritic conditions, treatments aim to relieve symptoms and improve the quality of life for affected individuals. Urinary tract infection, UTI. A urinary tract infection, UTI, can occur in any part of the urinary system, including the kidneys, ureters, bladder, or urethra. However, most infections involve the lower urinary tract, such as the bladder and urethra. UTIs are prevalent, especially among women, due to the sensitivity of normal bacteria present in their organs. Various strains of bacteria can cause a UTI, typically entering the urinary tract through the urethra and multiplying, leading to inflammation and infection. Sexual activity often contributes to the risk by pushing bacteria closer to the bladder. Symptoms of a UTI usually begin with discomfort or irritation during urination, accompanied by a persistent urge to urinate, even when the bladder feels empty. This urgency can be quite intense, often resulting in a burning sensation during urination, as the bacteria provoke inflammation. If left untreated, UTIs can lead to more severe complications, including acute or chronic kidney infections. Chronic kidney infections can result in permanent damage, impaired kidney function, or even kidney failure. The good news is that most UTIs can be effectively treated with antibiotics if symptoms are recognized early. Migraines. Migraines are more than just bad headaches. They are incapacitating episodes that typically last between 4 to 72 hours if untreated. Someone suffering from a severe migraine attack may notice the telltale signs upon waking: a dull ache building behind one eye paired with a visual disturbance known as a migraine aura. As the episode progresses, the pain intensifies into a throbbing headache, often focused on one side of the head. Even faint sounds like a ringing phone or footsteps outside can cause extreme discomfort. Unfortunately, many migraines do not respond to over-the-counter painkillers, necessitating more potent medications over time. According to the Migraine Research Foundation, migraines affect over 39 million Americans, making them the third most prevalent illness worldwide. While there is currently no cure for migraines, certain anti-migraine medications have shown efficacy in managing symptoms.
Thanks for watching. I hope you like it. Next video will be coming soon. Bye!